Hi everyone, welcome back to Psychology with Saara. I am Saara Gupta and today we're diving into a really important topic, anxiety disorders. So हम सबको anxiety होती है from time to time, but when does it become a disorder? So in this video we'll cover all that. This is an introduction to anxiety disorders. Let's get started. So first of all, anxiety disorder होता क्या है, right? Anxiety disorder is a type of mental health condition, right? If you have an anxiety disorder, you will respond to certain things and situations with fear and dread, and you will also experience physical signs of anxiety like pounding heart and sweating. And although some amount of anxiety is normal, like for example, अगर तुम्हें टेस्ट देने जाना है and you have a little bit anxiety, you're nervous, that is normal. And sometimes it can even be beneficial because it helps us notice the dangerous situations and focuses our attention so we stay safe. But anxiety disorder goes beyond the regular nervousness and slight fear you may feel from time to time. So anxiety disorder कब होता है? When your anxiety is interfering your ability to function, your reactions are out of proportion to the situation, your overreactions, and you can't control your response to situations. So children, adolescents, adults, सबको anxiety disorders होते हैं, and actually women are twice as likely to experience anxiety disorders. And obviously, anxiety disorders can make it very difficult to get through the day. But fortunately, there are several effective treatments for these conditions. So moving on to the next topic for today, types of anxiety disorders. So according to the DSM, there are several types of anxiety disorders which we'll discuss today. So first we have GAD or generalized anxiety disorder. So यहाँ पे this condition causes fear, worry and a constant feeling of being overwhelmed. So the person, they will have excessive, frequent or unrealistic worry about everyday things like job responsibility, health, chores. फिर अगोराफोबिया. सो अगोराफोबिया एक कंडीशन है जिससे इंसान को एक बहुत इंटेंस फियर होता है कि वो बहुत ओवरवेल्म्ड है, वो एस्केप नहीं कर पा रहे, हेल्प नहीं ले पा रहे. तो जिनको अगोराफोबिया होता है दे ऑफन अवॉइड न्यू प्लेसेस या अनफेमिलियर सिचुएशंस, जैसे कि लार्ज ओपन एरियाज और इन क्लोज स्पेसेस, क्राउड्स, प्लेसेस आउटसाइड ऑफ देयर होम्स. देन वी हैव पैनिक डिसऑर्डर. सो पैनिक डिसऑर्डर में मल्टीपल अनएक्सपेक्टेड पैनिक अटैक्स आते हैं. एंड एक मेन फीचर इस कंडीशन का क्या है कि जो अटैक्स है दे यूजुअली हैपन विदाउट अ वार्निंग and they're not because of any other mental health or physical condition. And actually some people with panic disorder may also have agoraphobia. Then we have specific phobias. So एक phobia क्या हो गया? एक phobia is when something causes you to feel fear या anxiety and it is very severe and it is consistently overwhelming, disrupting your life. And there are hundreds of different types of phobias which we'll discuss in a further video. And there's one diagnosis for almost all of them, specific phobia. Only one phobia, agoraphobia, is a distinct diagnosis. फिर वी हैव सोशल एंग्जाइटी डिसऑर्डर, जिसे पहले हम सोशल फोबिया भी कहते थे. इट हैपेंस व्हेन यू एक्सपीरियंस इंटेंस या फिर एक ऑनगोइंग फियर है ऑफ बीइंग जज्ड नेगेटिवली और बीइंग वॉच्ड बाय अदर्स. देन वी हैव सेपरेशन एंग्जाइटी डिसऑर्डर. सो ये कंडीशन कब होता है ना, व्हेन यू फील एक्सेसिव एंग्जाइटी व्हेन यू सेपरेटेड फ्रॉम अ लव्ड वन लाइक अ प्राइमरी केयर गिवर. सो सेपरेशन एंग्जाइटी इज काइंड ऑफ नॉर्मल इन बेबीज एंड टॉडलर्स बिकॉज उनका एक नॉर्मल स्टेज ऑफ डेवलपमेंट में आता है, राइट? बट as the person grows up, if they do not pass the developmental age in adulthood, then that can cause a disorder. Lastly, we have selective condition happens when you don't talk in certain situations because of fear or anxiety, and usually young children में होता है, but it can also affect adolescents and adults. इसके अलावा we have other mental health conditions जो सिर्फ फीचर शेयर करते हैं anxiety disorders के साथ, like PTSD, OCD, acute stress disorder. But जो AP है that classifies them as distinct conditions and not anxiety disorders. Okay, now let's discuss how common are anxiety disorders. So actually anxiety disorders are some of the most common mental health conditions, and actually specific phobias जो हैं they are the most prevalent because 12% of the population has specific phobias. Social anxiety disorder is also very common, 7% of the population, and generalized anxiety disorder affects around 3% of the population. And then the other anxiety disorders like agoraphobia सिर्फ 1.7% है, and separation anxiety is 4% of children and 1.6% of adolescents, 1.9% of adults. And then selective mutism is the least common anxiety disorder. Now let's discuss symptoms क्या होते हैं of anxiety disorder. So we have physical symptoms and psychological symptoms. So psychological symptoms में we have feeling panic या fear या dread या बहुत uneasy लग रहा है, बहुत on the edge लग रहा है, बहुत चिड़चिड़े irritable हो रखे हैं, अनकंट्रोलेबल लग रहा है कि हम आसपास के अपने सराउंडिंग्स, अपने एक्शंस कंट्रोल नहीं कर पा रहे हैं, बहुत ऑब्सेसिव थॉट्स आ रहे हैं एंड कॉन्सेंट्रेट नहीं हो पा रहा है. एंड फिजिकल सिम्टम्स आर कि दिल बहुत तेज धड़क रहा है, सांस नहीं आ रही है, मसल्स बहुत टेंस लग रही हैं, हाथ ठंडे पड़ गए हैं या फिर स्वेटी हैंड्स हो रहे हैं, ड्राई माउथ, यू फील लाइक वॉमिटिंग, nausea, there's numbness or tingling in your hands and feet, and either you're not able to go to sleep or you're not able to stay asleep. That's insomnia. So हमने देख लिया कि anxiety disorders क्या होते हैं, क्या symptoms होते हैं, but The main point is कि हो क्यों रहे हैं anxiety disorders. So there are like a lot of reasons, but let's look at like the broad ones. So we have chemical imbalances. So हमारे brain में बहुत सारे neurotransmitters and hormones होते हैं and they play a role in anxiety. We have norepinephrine, serotonin, dopamine and GABA. GABA is gamma aminobutyric acid. And जब इन सब में imbalances होते हैं then they can contribute to an anxiety disorder. Then we have brain changes. So you have a part in your brain called the amygdala, and the amygdala it has a very important role in managing fear and anxiety. तो studies क्या दिखाती हैं कि जिन लोगों को anxiety disorders होते हैं, they have increased amygdala activity in response to anxiety cues. फिर we have genetics. So anxiety disorders they tend to run in biological families. So ये suggest करता है कि genetics also plays a role. So you might be at an increased risk of developing one if you have a first degree relative with an anxiety disorder. And last है environmental factors. So severe या फिर अगर long lasting stress हो तो that can also change the balance of neurotransmitters that control your mood. If you experience a lot of stress over a long time, then that can contribute to an anxiety disorder. Or like if you experience a traumatic event, then that can also trigger anxiety disorder. So let's look at how anxiety disorders are actually diagnosed. So if you or like if example you are a parent and you have a child and they're experiencing symptoms of an anxiety disorder, so the first step is that you will go to a healthcare provider and there they'll do medical evaluation. So सारा physical exam करेंगे, they'll ask your medical history, any medications you're taking, अगर आपके किसी और family member को diagnose करा गया है, and although इससे related कोई blood test या imaging scans नहीं होते, but your provider may run some of these tests to rule out any physical conditions जिनसे symptoms आ सकते हैं like hyperthyroidism. तो और अगर there was not an underlying physical cause, फिर your provider may refer you to a mental health professional. So a mental health professional may be a psychologist or a psychiatrist, and they'll do like an interview or survey and they'll ask questions about your symptoms, sleeping habits, other behaviors, and then they'll use the DSM-5 criteria given by APA. And basically जो provider है they will base a diagnosis on क्या symptoms बताए हैं, how intense they are, how long they are lasting, how they are interfering with your daily life, and जो provider का observation है of your attitude and behavior. So supposedly you are diagnosed with anxiety disorders. So treatment क्या है, management treatment क्या है anxiety disorders का? So एक anxiety disorder is like any other mental health condition that requires treatment. So you can't just will it away. Like it's not a matter of self-discipline or attitude. Researchers have made a lot of progress in the last few decades in treating mental health conditions, and your healthcare provider will tailor a treatment plan that works for you. So we have medication for anxiety disorders and we have psychotherapy. So let's discuss both of those. Firstly, medication for anxiety disorders. So medications obviously cure नहीं कर सकते anxiety disorders, but तुम help कर सकते हैं in improving the symptoms and helping you function better. So we have antidepressants. So although antidepressants depression के लिए होते हैं, but they can also help with anxiety disorders because they can adjust how your brain uses certain chemicals to improve mood and reduce stress. So antidepressants actually some time लेते हैं to work, so you have to be patient for that. And you have SSRIs, SNRIs, they are kind of the go-to types of antidepressants for anxiety. Tricyclic antidepressants भी होते हैं, but उनके ज़्यादा side effects होते हैं, but so we don't use them that much. फिर we have benzodiazepines. So they जो benzodiazepines होते हैं, they decrease your anxiety, panic and worry, and they work very quickly. पर you can build a tolerance to them, so they have an addiction potential. So you have to take them very cautiously. So your healthcare provider may prescribe a benzodiazepine for a short term, and then they will taper you off. जिसमें तुम्हारे क्लोनाज़ेपम, डायज़ेपम, लोराज़ेपम ये सारे आ गए. Then we have beta blockers. So beta blockers क्या होते हैं कि they help reduce some of the physical symptoms of anxiety disorders like rapid heartbeat, shaking या trembling, but वो psychological aspects नहीं treat करते हैं. So जो भी तुम्हारा health care provider है, they will work with you to find the right medication combination या dosage. And इसके अलावा we have psychotherapy, right? So psychotherapy or talk therapy is a term for a variety of treatment techniques that can help you to identify and change जो भी unhealthy emotions हैं, thoughts हैं, behaviors हैं. So इसमें we have CBT, cognitive behavioral therapy. Everyone knows of that. It's the most common type of psychotherapy to manage anxiety or disorders. तो CBT अगर हम specifically anxiety के लिए देते हैं तो we teach the person to recognize and identify thoughts and patterns or behaviors जिनसे उन्हें troublesome feelings आ रही है, and then they work on changing those thoughts and their reactions to triggering situations. We can also do exposure therapy. This is the type of therapy जहाँ पे जो mental health professional है, they'll create a safe environment to expose you to your fears. And the fears can be like things, situations, activities. And self-exposure therapy says you will realize that you are capable of confronting your fears, and you will learn to attach to more realistic beliefs to the things you're afraid of, and you'll become more comfortable with the experience of fear. So let's look at the outlook and prognosis. So if anxiety disorders are left untreated, then they can lead to serious complications like जो a person है, they will have difficulty with social situations. Their quality of life won't be as good, and they might actually turn to self-medication like alcohol use, substance use. They may have major depressive disorder, or in cases of severe anxiety, suicide might also be a potential outlook. So constant anxiety also actually increases your risk of cardiac events like heart attack. And that is why it is very crucial to seek help if you have an anxiety disorder. Treatment is effective, and the right treatment can help you improve your quality of life, relationships, and productivity, and it also supports your overall well-being. Thanks for watching. I hope I was able to give you a clear introduction to anxiety disorders. In future videos, we'll dive deeper into specific anxiety disorders and discuss them in detail. If you have any questions or doubts, feel free to drop them in the comments below. Don't forget to like, share, and subscribe for more psychology content. See you next time. Bye.